So good morning, everyone. So we can start the session by now. A warm welcome to you all for the workshop on continuous professional development organized by the Faculty of Medicine, UAVLSE University. So today's sessions will cover on how to conduct an effective small group discussion, tutorial, and preparation of these MCQ questions. Today we are honored to have with us an esteemed professional who will guide us through invaluable learning experience. So without delaying, let us begin the event by inviting Dr. Gayatri Ratnayaka, Head Department of Biochemistry, Faculty of Medicine, to deliver her welcome speech. So Dr. Gayatri, it's over to you.
Thank you very much, Induja. Good morning, very good morning to all of you. It gives me a great pleasure to welcome all of you to today's workshop. As Induja mentioned, this is a part of our continuous professional development program. Today, the title is How to Conduct an Effective Small Group Discussion, Tutorial and Preparation of MCQ Questions. At the outset, let me welcome each of you and thank all of you for taking your time to join us this morning. This workshop series represents a key initiative of the Faculty of Medicine of UAVLSE University that is aimed to enhance the teaching and learning practices of our academic staff. We are honored to have with us today Professor Gominda Ponnamperuma, a distinguished academic in the field of medical education from the University of Colombo. We warmly welcome you, sir, to this event. And also, I would like to welcome Senior Professor Mudita Vidana Patirana, Dean of the Faculty of Medicine, who is the leadership behind this initiative. A warm welcome to you, sir. And also, I would like to welcome all the academic and extended faculty staff members from the Teaching Hospital Badulla who joined this event today. Once again, I warmly welcome all of you to this event, and I encourage everyone to actively participate, ask questions, and engage in meaningful discussions throughout the workshop. Let us work together to advance our teaching methodologies and uphold the highest standards in medical education. Thank you, and I wish you all an enriching and productive workshop. Thank you very much, Induja.
Thank you, Dr. Gayatri, for the warm welcome speech. It is now my pleasure to invite Senior Professor Mudita Vidana Patirana, Dean, Faculty of Medicine, UAVLSE University, to introduce our distinguished resource person, Professor Gominda Ponnamperuma, a renowned expert in the field of medical education. Professor Vidana Patirana, sir, the floor is yours.
Thank you very, very much, and very good morning to all of you. I'm grateful and honored to be invited, and at the same time, I'm delighted to introduce one of my longtime friends, Professor Gominda Ponnamperuma, from Faculty of Medicine, University of Colombo, Department of Medical Education. Dear Professor Gominda Ponnamperuma, in fact, you don't need any introduction. We have very few such experts in Sri Lanka, if at all 5-6 experts in medical education currently available in Sri Lanka. In fact, if I go into his academic career, he did his MBBS at Faculty of Medicine, and he had his PhD at Dundee University. He also the head of accreditation unit at SLMC, Sri Lanka Medical Council. And at the same time, I must tell you all, in the preliminary report of the SLMC, they had highlighted to train all the extended faculty members, if possible, on assessment methods during this, at least before the second batch completes its continuous assessment first examination. So in that line, we initiated this CPD program. He achieved excellence in research. His research interests are on assessment and curriculum development and evaluation. Regarding dissemination of knowledge, Professor Gominda Ponnamperuma has served as an invited speaker and resource person in many local and international symposia and conferences. He has authored several, he is the author of several journal articles. He has authored several journal articles and books. He is an editorial member of editorial boards member of 2 international medical education journals. Regarding undergraduate and PG postgraduate training, he is a postgraduate tutor, examiner, and resource material developer for national and international medical education courses for more than 20 years. He has served as advisor, visiting professor, consultant, and fellow in several academic institutes and educational projects. Regarding development and progression of medical education, he was a co-editor of the revised Sri Lanka qualification framework, as you all know as SLQF, and contributed to the development of quality assurance manuals for higher education institutes in the country. He is also on the WFME, World Federation of Medical Education, list of independent advisors for prospective accreditation agencies. He is a founder co-chair of the Asia Pacific Medical Education Network, APMEC. APME Net. I cordially invite Professor Gominda Ponnamperuma to deliver his CPD training program on how to conduct an effective small group discussion, how to conduct an effective tutorial, and third one is preparing MCQs. MCQs in the sense true, false, and single best answers, SBAs. So floor is yours, Professor Gominda.
Thank you very much. Thank you very much, Professor Mudita Vidana Papirana, for that very generous introduction. If you can unshare, yeah, I can share now. Yeah, right. So I hope you can see the screen. So our first part of this session would be on small group learning. There are many types of small group learning, and the special advantage of a small group learning is it's considered to be very student-centered, where we as teachers don't really spoon-feed the student. We don't teach them that much, but we guide them for them to learn. So the learning happens very much on their own with our guidance. So there are many types of small group learning methods. We will be discussing some of them. And also we will first look at what small group learning is and what are small groups. So what do you think? How many learners should be involved in a small group? I mean, not the ideal number, but at least minimum. You can unmute and talk, and then mute again, especially if you are in a noisy place. I hope you can hear me. Can hear, right?
Around 10 participants, sir.
Oh yeah, that may be the sort of the ideal. Ideally, it may be even a little less than 10. But how many should be at least there to start a small group? Well, I mean, one person cannot, right? So it will have to be at least 2 people to start a discussion, to start a small group learning session. So more than 2 people in the educational setting, 2 learners, that's a small group. It may be for learning or it may be for something else. Because at least if there aren't 2 people, we can't say it's a group. Then what is small group learning? Those 2 people or more than 2 people would be doing something focused related to learning. So more than 2 learners engage in a learning activity to achieve a common goal. Discussion, a practical learning activity can be anything. And there is a common goal. That's why just two people won't qualify to be called a small group, which is meant for learning. So a learning small group will have to have a common objective or a common goal, and there should be some learning activity. Now, what is the ideal number? What you said is more or less, but probably 6 to 8 would be the ideal, but I know in our setting it may not be possible. So what they see is anything between 6 to 12 would be good, but 12 would be on the higher side. 8 would be sort of ideal. Why do we say that? What will happen if the group number increases? I'm sure you may have also experienced that. What will happen if the group number increases? Anything from your experience? I mean, it's not, I'm sure you may have experienced that. Either as a teacher or even as a learner in the past. When there is a large number in a group, what will happen?
Some people will not engage.
Exactly. So some people will be just there without contributing. That is possible because they are not forced to do that, because there are others to do it. So why should they bother? Let them work. So then, of course, they are losing because they are not then learning, but that will happen. And also, there may not be enough opportunity for a given person to contribute also. If there are 20, 30 people in a group, obviously, each member's contribution will be lost. There will be less if everybody is to contribute. So that is also not being fair by the learner. So a large group is not good. What if a small group, like 2 learners? What will happen if there are too small a group? What will happen?
There's not enough participants to discuss to get an effective.
Yeah. Yes. So the amount of discussion will be less. Variety of ideas that will come into the discussion will be less. So learning from each other will be limited to 2 people. So purpose of a small group is to learn from each other. But if there are very less people, then that peer learning will be somewhat deficient because you are learning from just one person. So for those reasons, 6 to 8 is considered ideal, but anything between 6 to 12 would be acceptable. Right. How is this different from lectures? So here you learn within a group. So how is it different from a lecture? I mean, we also discussed during this short period also some other differences. So in a lecture, how does learning happen?
Mainly it's teacher-oriented.
Yes, it is from the lecturer. So there is considered to be a superior source of information, and that is the lecturer. And usually the information transfer is unidirectional, one way. Lecturer speaks, the students listen. So the information passes from the lecturer to the student. In fact, a cynic defined lectures as transfer of information from lecturer's notes to students' notes without going through the brains of either. So that's a very extreme definition, but that can also happen. There is no processing of information that much. It's just giving information and receiving information. So then the intellectual functions during a lecture will be less, but during a small group, if the small group is happening well, the intellectual functions will be much more. So there are obvious differences. One is there is one lecturer in a small lecture in a small group. There may be a lecturer, but that lecturer is called a facilitator. He is not considered to be a superior source of information. In fact, he is just a part of the group. He may contribute to the group activity here and there if he or she thinks necessary, but that will be very limited just to fill a gap, if at all. And that also, he will not be doing it explicitly. He'll be probably prompting somebody else to really come out with it. So in a lecturer, in a small group, there is no lecturer, only a facilitator who helps the learner to achieve the learning objectives. I think help is the key thing there. Learner is the one who achieves. And we call this type of learning active learning and not passive learning. So passive learning is the lecture that I just now described. Of course, we don't have such lectures now. There is two-way transfer of information, even in a lecture where we call an interactive lecture. But old-fashioned traditional didactic lecture would be like that, where you are not, as listeners or students, you are not supposed to talk. You are supposed to listen, write, and take down notes. Then it's very passive. Then it's just a matter of transfer of information. This would have been actually okay in the past, where sources of information was very limited. In fact, some of the, or most of the places, the only source of information would be the lecturer. Students may not have had access to even textbooks, because textbooks printing was expensive, especially in resource poor situations. That was very much the case. So lecturers, the lecture and the lecture note is the only source of information. So lectures had a function those days. But as you know, now information is not a problem at all, and textbooks are really a secondary source now, because we have what we call the internet. And that's called the expressway of information, or information highway. Basically, you can find anything. Of course, you need to be selective. You need to know how to find, and you need to know whether this is a trusted source and this can be believed. That you should be able to cross-check. All that is necessary. Some amount of skills would be necessary for that, but we have the information. So actually, the purpose of a lecture has been diminished to that text. But if the lecture is also quite interactive, where the lecturer makes the student to think, then that would be a different story. Think, process information, that sort of a lecture would be a different lecture. But here, by definition, small group, or by design, the small group is not to receive information, but to process information. So it's then about collaborative learning and peer learning. You learn from each other, you learn from textbooks, internet, if you have lecture notes, everything else other than a designated lecturer to give a lecture. The lecturer may come in and prompt certain things for you to be guided if you are going off track. Then, of course, the lecturer will come in and guide, and that's why the lecturer is called a facilitator. or if you are totally off or totally incorrect, then the lecturer may guide to certain sources of information for you to read and get corrected. Of course, failing that also he might have to intervene, but most of the time that will do. When you are guided, you may realize, okay, you were wrong, and you will come to the right track. So that's a very sort of a collaborative peer learning is a very active type of learning and a very rich source of learning, because you learn by processing information. Basically, active learning is all about you just don't receive information, you process information, then it will stay with you for a longer time. And also then you will know how to apply the information. Otherwise, you will just assimilate information for the sake of information, not knowing what to do with it. So in a small group, no one is a superior source of information. Everybody will be the same, including the facilitator. And of course, there are obvious differences of settings. So lecture we conduct in a lecture hall, but a small group will be in a small group room where the configuration of furniture will be different. The sources of material and information available to the learners will be different. And the functioning of the learners and the facilitator would be quite different. We'll discuss about them in the next few slides. So that's the configuration difference. As you can see, it's a circle, not a lecture type of furniture arrangement in rows. Why do you think that is necessary? Any reason why you should think that that's necessary? Why can't we have a small group in a lecture theater where there are rows?
There can be more interaction when there is when the students are placed in this position.
Yeah, eye contact. To talk to each other, you need eye contact. And that will not be there if you sit in rows. So, I mean, all these have a reason. You should not do things mechanistically. Okay, they tell us to make a circle, so let's make a circle. That's not the reason for doing it. Everything has a more educational reason. Right. And the learners can have various sources of info or various learning resources. So they can be sources of information, pens, pencils, laptops, textbooks, then a whiteboard or something like that, so that they can write what they learned. All this will make them process information and digest information. And that then you don't need to memorize things. So this is a typical small group configuration. Of course, I need not say that it should be in a quiet place, which the learners are not disturbed too much. Those are basic things that a well-lit place, I mean, those are basic facilities need to be there. However, you don't need always an air-conditioned room. If the basic facilities are okay, even under a tree is okay. That is, if light is there, of course, under a tree, there will be good ventilation, and it's relatively undisturbed in that case, and you can sit in a circle. And of course, you have, if you good in this day and age if you have Wi-Fi facilities, because then the learner can get into the laptop and find something, and there is something to write on a board or a flip chart or something. In that case, you don't need a building. If you have all that under a tree, that's enough. Okay, so there are all are learners, but there are special people or special characters in a small group. One is the chairperson. Chairperson is the person who leads the group activity. Then there is a person who records the important discussion points, important decisions that the group took. That's the secretary or the rapporteur. That person can write on a paper and then tell the group the proceedings so far, a summary of the proceedings so far, when the group demands, on demand. He or she may, of course, he or she will have to summarize it at the very end, but even before the very end, they can, the group members can ask for a summary so far. So that's the purpose of the secretary. Of course, both chairperson and secretary are learners. So they have to learn too while doing their job, their other job. One chairperson is to lead and the secretary is to note down. I mean, those things cannot be considered as extra activities because they will be also part of learning. In fact, if you are taking up one of those roles, probably you may learn better. When the secretary writes, she has to summarize and write, or he has to summarize and write. That will be another learning activity, processing information. Then you find the facilitator who is a lecturer or a tutor. He or she also will be seated in the circle. Of course, the duties of these people are different because strictly speaking, the facilitator will not be, of course, he or she can learn during the discussion, but his or her task is mainly to see whether the group is functioning well and the group is not stuck. They know what to do and they are doing it. Right. What are the roles of the chairperson? Of course, the chairperson is a learner. So primary role is to learn, but in addition to learning, he will have to lead the group democratically through consensus. So what are the things to do? Facilitate. If you are appointed the chairperson, then you have to facilitate the appointment of a secretary. Of course, that should be done in collaboration through consensus, not sort of very arbitrary, saying that, okay, you become the secretary, rather than it would be good for the members to elect a secretary with the consent of that person. He or she can assign different tasks to different members, but that again will have to be through consensus. The person who is assigned should really volunteer or should accept what was given. So read this paragraph, go and search the internet. Those are the learning tasks that different people can be given. Go to the library and take a book and come and read whatever the page. Can you go and draw on the whiteboard a diagram that is needed for this discussion? So any learning activity is fine. Can you summarize? Can you tell it in another way so that others will understand better? Of course, the leader can say, the chairperson can say, but any person can voluntarily do that also if he or she thinks it's appropriate. Then there will be people who dominate the discussion. That is, they will be contributing more than their share that is expected of them. So then what will happen is you will block the others. Others will not have the opportunity to contribute. Plus, that person will be trying to take the group where he or she wants. That may not be the objective of the group. That may be different from the objective of that learning task. And actually, these dominant people will also suppress the others. He or she will want it to happen in the way that he or she wants, not through consensus. So such people should be subdued, should be controlled. Then, of course, what is even more common would be, especially if the group is large, there will be passive members. Okay, you better do the task, I will listen, or I will watch. Of course, that person will be missing a lot because he is not actively contributing. But some people prefer to do that, especially if there are others to do it. In that case, they will lose, but you have to, as the leader, the chairperson will have to prompt them and say that if you don't contribute, you will be the biggest loser, but you are not being fair by the other members also, because you are considered to be part of this group. Then the chairperson will have to identify deviations in the discussion and bring the group back on track if necessary. Sometimes the group may go on a tangent and deviate from the main theme that should be discussed. In that case, the chairperson will have to identify that and then bring the group back to the mainstream. Then, again, if the group is large, there can be groups within groups. 2 or 3 people get together and start a discussion on their own, excluding the other. That should be prevented. So basically, the chairperson's role is more or less a housekeeping job, ensuring that the group functions appropriately. Manage time. Sometimes the task will have subtasks. And if a subtask is consuming more time, the entire objective cannot be addressed. In that case, the chairperson will have to step in and say, look, we are short of time. Why not do this quickly and then get on to the next one? Although these are functions of the chairperson, any other member can also point to the chairperson. I think we are taking too much time on this. Can we, without maybe discussing so much, can we see what is there on the internet and then so that we can short circuit the discussion? So something like that will have to happen. Then, of course, I think not mentioned, if there are differences of opinion and which will lead to an argument and which will disrupt the group process, then the chairperson will also have to step in and say, okay, let's find the answer. Go to a source, find the answer, and then that will be the end of the argument. Then we know what is right. Because one student will say this is right, and the other student will say, no, that is right. That is not right. This is what is right. Then that's the chairperson. Next, the secretary. As I told, he or she will have to take down salient points. Not everything that falls from a learner, from a learner's mouth. No, but the important things. So in a way, the secretary is all the time trying to identify important things so that he or she can build a summary. Summarize at the end is a must, but summarizing on demand is also good. Anybody can demand, okay, how have we fared so far? What have we discussed so far? Can we have a summary? Then the role of the facilitator, that is you. That's your role, but you need to or understand the others' roles also, because you are basically, although you are not in charge of the learning process, you are in charge of the overall situation. If certain things don't go well, it's your duty to correct it. I'm not talking academically, even non-academically. Academically, of course, it's best not to intervene too much, but rather guide them to different sources, because then they can identify, okay, what we said is wrong, what we decided is wrong. Rather than the facilitator saying, no, you are wrong, this is the correct thing, take down this. Then you convert the small group to a lecture. That also happens, because you know that is wrong and you can't wait till these people get the answer. You think it's far easier to teach them rather than these people stumbling upon each other, trying to find the answer and then getting it wrong and then trying again to get it right. It's you are too impatient for that. It's far easier for you to give the answer and you give the answer. Then the entire process of learning is disrupted, and probably the entire process of learning is not happening. Then it becomes a teaching session. The losers will be the student, because then they will expect you to give the answer all the time. This is very easy. We need not worry too much. Let the facilitator give the answer. We can take it down. But the entire process of learning will be lost, and they will forget that information very quickly, and they will not know how to apply. So those are the reasons for having small groups, and you can kill those reasons if you try to teach in a small group. So ensure that the groups function smoothly. In fact, a silent facilitator is not a bad thing, it's a positive thing, especially if the group is doing well. If the group is not doing well and if the facilitator is silent, then of course it's a bad sign. But usually a facilitator who knows what to do, but still he seems to be not doing anything, that's a very good sign. That's a good group. Ensure that all learning objectives are achieved by the end of the session and provide guidance to the group where necessary. Only the guidance. You are a guide. And only when it's necessary. Guiding need not happen all the time. Now do this, now do this, now do no. Let them do it in the way that they want, as long as they achieve. How about the others? Other learners? If they are to benefit from this process, they need to do certain things. Listen. That's the most important. It's not, small group learning is not all the time talking. You need to listen to them and then give your contribution. Then talk. If necessary, you need to read things just to check whether what the other person said, or just to check, is there other types of information that we have missed. So you can read from the laptop, from the mobile, from a textbook, from a lecture note, whatever. Right? If there is something that you did not know, otherwise you will forget it, like a lecture. You need to write it down. Not only the secretary, even the learners. Think. That's absolutely necessary to do all these. Talking, reading, writing, you need to think, process information. You can discuss, argue, put forward a different way of thinking, if that is necessary, question another's viewpoint or another person's contribution, of course with reasons, with evidence. I don't think you are right, let's read this type of thing. And in short, actively participate and contribute to the evolving process of learning. So it's a very active thing and very engaging thing, and it's a very rewarding thing for the learner. Learner gets the feeling that you have achieved something together. Whereas end of a lecture, you don't really feel that. You get the feeling you have listened to something. But when you do something, you get a sort of self-satisfaction. And then you get ownership to your learning. Okay, I learned it. Then we look at how should these people function. So as I said earlier, it should be two-way exchange of information, not just one person talking and the others listening. So that's why I have included a double arrow. That means the information moves either way. And there will be many such double arrows. Now that's a good functioning group. Everybody has a fair share of group activity. Nobody is talking too much or talking too less. Everybody is exchanging information. That's a good group. What about this? This is a dominant member, the member that I have included. Because he seems to be talking too much at the expense of some others. Who is that other who is not contributing adequately? Where is that person? Is there a person who probably may not be contributing at all to this process? Yeah, the top one. That's a passive member. So that's not the group dynamics is in disarray in this group setting. That's a dysfunctional group. Either the chairperson will have to step in or the facilitator will have to guide that this is not the best way to function. Then any group process will have a life cycle. First, the group has to form. Then there will be forming includes introducing oneself to the others, especially if the group does not know each other. This happens usually in the first year, but thereafter they know each other. But still, there is a forming stage. Even if they know each other, they have to decide what they should do and how they should do it. That's part of the forming stage. When you do that, there will be arguments, different viewpoints, different ways of thinking as to how we should achieve. So that's the storming stage. Once that is over, that will go on for a few minutes, and then people will come to a consensus. If that is not coming, then it's the role of the chairperson. If the chairperson also fails, it's the role of the facilitator to make them come to an agreement as to how it should be, the task should be tackled. That is normal. Everything becomes normalized. And now the stage is set for learning. And that's called perform. And once the task is done, of course, the group can disperse. Also, we say that there are three triads, or there is a small group triad, three things to look at in a small group. Obviously, there is a learner, then there will be a facilitator, and for the learner to learn, there should be a trigger or some stimulus for the learner to learn. Most of the time, our triggers are written problems or scenarios. So, because we are training students to function as doctors. So the scenarios that doctors will encounter would be the natural stimulus or the trigger for any small group discussion, where the learner can apply the learning to that scenario and learn through that scenario. So then it becomes very work oriented, because a common problem when you give a lecture is students don't know how to apply. And also there may not be that much of work relevance, practice relevance in what you teach. But here in a small group, it's the practice relevance can almost 100% be guaranteed if you choose the right scenario. So that's the trigger, and there will be interaction between three or among all three. Learner and the trigger, facilitator and the trigger, learner and the facilitator. Steps in a small group. Obviously, you need, of course, the trigger need not be only in the written format. It can be a photograph, it can be a video, or it can be a combination of any of these. It can be an activity also, a role play type of thing. Watch the role play and then start discussing. That's also possible. So trigger can be anything. You can be very creative and develop very creative and engaging triggers. Trigger will to a great extent determine how much they learn and how active the session will be, how engaging the session will be. So if it is a text-based scenario, you need to read. Of course, if it is non-text based, then of course, then you will have to watch or observe. Identify what the main things, keywords. We usually ask the student to underline those keywords in a group, not individually, together. Then if there are keywords that or phrases that need clarification, you can go for a definition, you can discuss and come to a agreement. Okay, this is what it means. Read, understand, analyze the trigger or the scenario. You can read several times, that would be even better, until you get to the bottom of it. You understand, you as a group understand in the way that it should be understood. Then whatever knowledge you have, you can apply to the scenario. And you can develop a scenario such that it is entirely within the learner's existing knowledge. That's a classical small group discussion. Then the purpose is to train students to apply knowledge. Sometimes there may be differences of opinion, perspective, solutions to the same problem. That will be all good learning. And the learner will have to recognize those. Okay, there are more than one ways of doing things. Try to come to conclusions towards the end. If you cannot come to conclusions, then you need to know why you can't, and there may be need for further learning. That's a classical, what we call a problem-based learning session, where we develop the scenario such that students will not be able to tackle it with their existing knowledge. We need them to learn more. Then you identify, okay, we can't come to conclusions because we lack knowledge in these aspects. Then the group will formulate learning issues and go back, learn and come again. But that's a PBL. A classical small group, they should be able to tackle the scenario with the knowledge they have. In that case, conclusions, they can achieve at the end of the session. Usually this is around a 2-hour session. Then if that is the case, or even if they have formulated learning issues, still you need a summary at the end. You can have a summary even before the end, but definitely you need to have a summary at the end. So this is to ensure that all learning objectives or learning outcomes are achieved. And above all, this is an enjoyable process. This is not a stressful environment. This should not be a boring process also, because a lecture, if you listen to the same person, you might get bored after some time. But here, that is not the case. You are also actively contributing as a learner, so you can really enjoy. So all this would be done not individually, but as a group, collectively through collaboration. That will bring a lot of variety, richness to the learning. Identifying what another person said is wrong and cross-checking, that itself would be learning. And that sort of learning will stay with you because you have not been fed that. You have actively learned. There are some ground rules. Respect each other's views. You can't ridicule. Even the most stupid response will have to be respected. Respected with respect, point out that is not appropriate, that is not a viable proposition. So do not ridicule or laugh at another. Appreciate another viewpoint. Disagree with respect. You can disagree, but with respect. Speak one at a time, not too much, not too little. These are basic things, but because this type of learning, most students will be new to them, that this type of learning, you will have to tell them. You as a facilitator and probably as the chairperson also need to appreciate silent moments. Silent moments are sometimes very threatening. You don't know what to do. But you have to read the mood of the group. If you think the group is, because the group can be silent due to many reasons. What are the reasons that the group can be silent? And those different reasons will require different actions. What are the reasons for the group to fall silent? You will come across this when you do small group, and you may have already come across. You are doing small group. Then the easiest is for you to do a mini lecture. And some people may be doing that. Okay, they don't know. Let me teach. Then you are also happy. Oh, I taught. Now they learn. You think they learn. Probably they didn't, and even if they learn, they will forget very soon. So what are the reasons for? A group being silent? I'm sure you may have come across if you do small group learning even now.
Content is very new to the audience.
Sorry. Can you be a little bit more loud?
When the topic is very new to the participants.
Okay. so the participants don't know where to start, or they have started and got stuck. In that case, what should you do? You as a facilitator.
Initially, give a brief introduction on the particular topic before commencement.
Then you are taking over the role of an information provider. Then you are starting a teaching session, and all students will love it. They will let you talk, and the time will be over. They will all disperse very happy, because there was nothing for them to do. They are happy at that time because they are not on the spot anymore. Teacher did the talking. Fine. And here we go. But of course, long term, they will be very unhappy now, because that will happen when they sit an exam. So other than that, what should you? Sorry.
If there is too many arguments within the group members,
then there will be a lot of talking, right? Here it's a silent.
oh,
Here is a silent group. So one of the reasons is yes, stuck group, a group does not know how to proceed. Of course, if what you meant was, if the trigger is very, very, very advanced, then it's a bad trigger, obviously. Then there is a trigger problem or a scenario problem. That's why there is a little bit, you need to have a little bit of skill to write a good trigger also. But even then, what should you do now? Because now you can't say, no, this is a wrong trigger, let us. What should you do? So what is your role there? I mean, what is your role in any way in a small group? Not to teach. Then what? So that should be firmly in your head when you go to facilitate a small group. I'm not going to teach. Even if it is obvious for you. And even if you are tempted to do it. Then what should you do? So what is your role? What should be the role? To guide. So now the group is stuck. So what should you do? You should provide further stimuli, further prompts, or further direction. Let's read this together. That thing should have the answer, at least to start a discussion. So they read, they learn, not you teach. That's guiding. If not, it's very easy to convert a small group to a lecture. Obviously, student will be not doing everything 100% right. Then it's very easy for you to conclude, okay, they don't know, let me teach. They don't know, correct. That's why they came. That's why they are students. But here you want them to learn trial and error. Make mistakes and learn. Learning after making mistakes is very, very strong. Then you don't forget. Learning by just listening to somebody is very, very weak. You may forget everything. that you listen. And this is not new, you may be already knowing this. So one of the reasons would be a group that is lost, that is stuck. Another reason would be, so then your guidance is necessary if the chairperson cannot handle it. What else? What else can be the reason for a silent group? What else? Silent group. Can't the group be thinking together? When you think and intensely think, you may not be talking. So they are intensely thinking. So that's why you need to read the mood of the group and decide, okay, this is due to this. If that is the case, you should not intervene. Let them think. They are thinking. They are not just coming out with whatever the first thing that they came to their mind, but they are processing some information and trying to make sense. Then you should allow that to happen. Then you also need to be silent. Let them think for a while. And if it is too long, of course, then you will have to intervene. Then they may be stuck. So appreciate silent moments that the chairperson and the facilitator should do and should take measures if necessary. Then the learners should not just talk which are not connected. Talking that is not connected. That doesn't build up anything. So you have to build on others' comments. Then the discussion will progress nicely. And share knowledge and ideas. Now, because we have been brought up in silos, basically, as learners, especially during the school days. So the students who come to you maybe not understanding the value of this. And they may also be thinking, okay, I can learn, because in a way we have been sort of brought up in a sort of a very selfish environment. So we may be thinking, okay, let me listen and get everything from others, but I will not give them anything. I know certain things, but I am not going to give them. Unfortunately, the biggest loser will be that student. So that students need to be told about that. Because although they may be thinking that they know something that the others don't know, that could have been tested if you put that out. Probably the thing that they know, thought they know, may be wrong. That was not tested. That was not put to the test by sharing it with others. So you will be the biggest loser if you do that. If you try to learn from others but not give anything back, then the process will be that much deficient. Why do you have to do all this? As the tendency is, it's much easier to give a lecture. You can put all of them together in one hall or one room and teach it in a much lesser time. Because you can rattle off everything. There is nothing wrong or inaccurate there, everything accurate information, just give it. You don't need to waste time and resources by grouping them and then taking them. Why should you do this then? If you don't know why, you may be also thinking about this. Why are we doing this? Many of us trying to do this in small groups, whereas just one of us can go to a lecture hall and tell all this and come back.
As it is in lecture, if you compare the grabbing from one person, if you actively participate, you will retain for a long time.
Yeah, retention is the most, retention and the learning. It's easy for us to give a lecture, but it may not be the best for the student. So we have to think always through the student's lens. So when you see something through a student's lens, what we remember most is what we learned, not what we were taught. If we actively engaged ourselves, processed information, then it will be stronger learning. So although it may be a nuisance to us, for the student, this would be the best, rather than trying to teach, because actually there's nothing to teach. Students don't need to come to you to learn. They can listen to the best lecture in the world on the YouTube in the same topic that you would be lecturing. So if that is the case, do we still need to teach? So our role in this day and age is quite different. Not to teach, but to make them learn, facilitate the learning. That they need. Because the YouTube lecture will still not make them good appliers of that learning. They may not be able to teach through a lecture how to apply knowledge. For that, you need to apply it, and students may need assistance when applying knowledge and trying to come to conclusions. Plus, that will strengthen their learning, and they will learn better. They will get a greater understanding when they do that. That's one aspect. Second aspect is the group effect. When you learn together, there will be a lot of information from different directions, from different learners. So always 2 brains better than 1. And many brains better than 2. So we said that the learner will have to do all this. Why do we say that when you do all this, it's a better learn? We achieve better learning. Why? Because all these activities, learning happens in the brain. All these activities will stimulate different parts of the brain. So there will be many neurons contributing to this learning process. And there will be many neuronal synapses made during the process. If you only listen, that is to do only the third one, only a few neurons will be stimulated. That's why after a few minutes, you fall asleep. Rest of the brain is anyway sleep. So that's the brain. So as you can see, as you know, there are different parts of the brain which are specialized on different activities like auditory area, visual area, so listening, seeing, motor area, doing things. So a good learning session would stimulate all these parts. Then the students will not fall asleep. Otherwise, it would be very easy for you to make the students sleep. Again, there are two hemispheres, although this is not exactly the way that this is told, but we know the two hemispheres are specialized in different things. So, art of discussing can be combined with more scientific information. So the artistic part is on the right side of the brain and the more scientific part is on the left side of the brain. So you can make use of this both hemispheres when learning in a group. You can draw things in a group on the board. So all that will stimulate different parts of the brain. Whereas if you are seated and just looking at the lecturer and the board and then listening, there is very little stimulation that happens there for learning. What do we remember? Of course, again, this is not a very accurate, but on average, roughly, we remember around 20% of what we read. We remember around 30% of what we hear. We remember around 40% of what we see, around 40%, 50% of what we say. That's why people say teaching is a good way of learning. If we do things, apply, we may remember around 60%. How can you achieve anything more? These numbers will change, right? These are very average numbers. Of course, based on some research, but individuals differ. Some are auditory learners, some are visual learners. So these numbers may change from person to person, but on average. But the fact is that no one input of information will give you the entire picture. Will give you the entire amount of information and entire amount of learning. How can you achieve more than 60%? What should you do? What should you do?
Group learning would have all those things.
Ah, there you are. Do it all. Do it all. Do it all. Don't just bank on one mode. All are good, all have limitations. Do it all together, then all those limitations can be overcome. Of course, still 90%, 10% will be lost. That's the normal part of forgetting that you can't do much about, but you ensure that the maximum can be achieved if you do many learning activities through using all your senses to assimilate information. There will be many inputs to the brain by different organs. Eyes, ears, hands, you name it. Mouth, all that. Right. This can be done even in lectures to an extent, but not to the extent that a small group can do. Some of these methods can be even used in lectures. So bus groups, snowballing, fishbowl, brainstorming. Then of course the latter two would be the classical small group methods. But you can build the first four into small groups as well as into lectures if you think necessary. So bus group is to give a task and say discuss with your neighbor, even during a lecture or during a small group. So just two people are discussing. So that's the basic configuration of a small group. Just two. And why is it called bus group? Because that will give rise to a buzzing sound. Sound like the bees flutter their wings. That's the buzz. So if you give and discuss with your neighbor why bus groups are called bus groups, that discussion will generate a buzzing sound. That's right. So that can be employed at will, even during a lecture, so that the lectures will be interactive. But of course, yeah, it's a small group method, and the small group can be done very well. In a small group, this can be done very well. Snowballing is an extension of, sometimes you call that syndicate groups, small snowballing. It's a bus group. It starts like a bus group. The step one is a bus group, talking to your neighbor. Then two neighboring groups combine to make groups of four. Then they discuss what they discussed in twos. Now they discuss in fours. So there will be new information coming to the step two. So you can go on like this. Then groups of four can coalesce, get together in groups of 8 and start discussing what they discussed earlier in a group of 4. And you can go on actually. Go on until the entire group becomes one even. But usually in a lecture, you can't do more than maybe groups of 4 maximum. Maybe if you sort of have furniture arrangement in that way, maybe you can go to group of 8, but definitely not more than that. Fishbowl is another way of usually good for even role plays and debates, that sort of thing, where you divide your group or your entire class into 2 and ask one group to do an activity, other groups watch. Then they swap roles. The group which did the activity will go to the observer, the periphery, to observe. And the group that observed will do another task or the same task. The others will critique. Always the observers will critique, so that they also learn, the people who work also learn. Brainstorming is probably a very open discussion, open, unrestrained discussion, free, unstructured discussion on a theme or a topic. Usually no objectives conveyed to the participant except requesting views on a topic. So it's up to them to just go. You give them a blank slate. Do whatever you want with this topic. And this is marvelous for generating ideas. If you want new ideas, this is very good. Why? It's not focused. By nature, it's not focused. Sky is the limit for you to go. So generating ideas, research groups can obviously employ this if you want research ideas. Or even usually these ethical scenarios, this would be good. Where you need generation of different perspectives. Wherever you want a rich generation of different perspective, this is good. Small group is the classical small group that we are discussing, where the student knows everything, but we want them to apply what they learn to a situation or a scenario. So it's structured, at least semi-structured, and there are a set of learning outcomes that they need to achieve. Usually it's a single session because they have the knowledge. It's a matter of applying. Even things like ethical dilemmas, this is good. Anything is good. For anything, this is good. As long as you know that the figure that you give is within the learner's level of knowledge. You don't need them to learn anything more. They will learn certain things, but majority of the knowledge needed to tackle this problem is with the learner. Then it's just a matter of making them apply the knowledge, because that will strengthen their learning. Otherwise, the knowledge, they won't have anything to hang the knowledge. When you don't have anything to hang the knowledge, they are loose and they will be in no time forgotten. So objectives or learning outcomes are known. Usually also excellent to understand the diversity of different viewpoints, different ways of solving a problem, and so on. A PBL is a much more focused one. The main difference between a small group learning session and a problem-based learning session is that problem-based is also a small group, as you can see. But the problem you give, the students will not have the knowledge to solve. In fact, solving is never an endpoint of a PBL. Students can go without solving the problem, but they tackle the problem. When they tackle the problem, they learn new things, because the students did not have everything that they should know when they first came across this problem. By trying to solve the problem, they may solve it, they may not solve it, but they will learn. Learn things that you wanted. Learn things in the curriculum. So usually it's a multi-session, at least there will be 2 sessions, because they need to go home, study, and come back and see whether they can now tackle that problem better. So usually these are clinical scenarios. Again, there are learning outcomes objectives. They don't give that to the student. Students need to generate the outcomes in a group. And of course, the facilitator will have to see what the students generated is what the curriculum also wanted. Because the facilitator will have, the person who wrote the scenario would give the learning outcomes to the facilitator. So students gain new knowledge. New knowledge is the key word here by trying to solve the problem. Again, excellent for any clinical situation. This would be good application of basic sciences to a clinical situation. And plus, even this is good. Even the application of basic sciences to a clinical problem, even as just a small group, is good if you know the students already have the knowledge. If you want the student to learn more new things, that means you have not given a lecture. You want them to learn through group activity, then PBL is better. Then they learn on their own. This is all about self-learning. So this is a classical PBL. There are 2 sessions. You present the problems. Students do exactly what we discussed. Give me a second. I have to plug this. So the students will discuss first what is in the trigger and underline the keywords. Do all that we discussed. Do all that we discussed earlier. Read, reread, understand, look for different difficult phrases or words, understand together. Then they develop a problem list. In order to solve this, we need to do these things. And some of them, they may already have the knowledge. They can solve those subtasks. But the others, they don't have the knowledge. So those will be their learning issues. And with those learning issues, they disperse, come back after about 1 week after learning about them. That's their new knowledge. And they then together, they table everything that they learned and reapply to the problem and see whether they can come to the bottom of it. So in PBL, the problem will be slightly ahead of what the students already know. But how ahead are they is a decision that you need to take. Basically, there are consequences. So let's say this is students' pre-knowledge. This is what you want the student to learn, unknown. Then where should you have the trigger? Where should you have the trigger? Is it in the blue space or in the beige colored space?
Beige color.
Yes. In the beige color space, where? Is it nearer the blue or away from the blue?
Nearer to blue.
Good. Why?
Because they need to form a solution with what they have the knowledge, no?
Yes, I think you are right, what you are saying. So, I mean, you can basically, if you have enough support, you can set the trigger at any place. However, you can set it here. Then you expect only the students will gain this bit. Students will not gain the other bit. Or you can set it here, then the students will learn everything. But when you set the trigger here, it's so far away from students' pre-knowledge, students may not be able to get here even with good facilitation. Because it's far away. It's like giving an advanced level paper to a grade 4 student. They will not even attempt it. They will not know how to attempt it. They will not even understand the basic terminology. So that although we think, okay, we can set a very hard problem and then they will learn a lot, that's counterintuitive. Although that's the intuition, that may not happen. So it would be good to decide. Of course, if you set the trigger very close to your pre-knowledge, then there will be little learning. So you have to strike a balance where it is enticing for the student to achieve the new learning, while it is not discouraging for the student to give it up. Say, no point, this is far too advanced, forget it. So that's the level that you should try to achieve. Of course, in case-based learning, in small group discussions, where should be the trigger? Is it in the blue or the beige brown color?
Blue.
Blue. That's simple. But then they learn application of knowledge, plus they learn many more things. Communicating with each other, teamwork, leadership, professionalism, all that is being learned along with application. So the trigger needs to be stimulating, interesting, inviting to learn, whether it's PBL or small group discussion. Right. in summary, small group discussion have a lot to offer that you can never achieve individually or through a lecture. Because lecture is also an individual type of learning. But that is only if it is done properly planned, which method to use, for which purpose, and properly implemented. You as a facilitator should be thorough with your role, and all the learners should also know why you are doing it. If the learners do not know, they will also see why can't they give us a lecture? Why do they want us to go through all this? It's so easy if they give us a lecture. That would be the thinking if they don't know why it is done. Always, when you learn something after getting it wrong, it's stronger. That you know already. So this is something like that. Trial and error is always stronger. Tutorial, the next topic. Well, it looks like a small group because the number is small. Why the number is small? Because we need to interact with the learner. If there is a large group, we will not have time to interact with the learner. So how is this different from a small group activity? That's a classical tutorial. The one with the one here is the facilitator. All the others are learners. Usually they are in rows. How is this different from a small group?
Here, the knowledge is not shared in between the listeners.
Sorry, come
It's
again.
only
Knowledge is not.
now they are not discussing in between themselves. They are only
Good. Yeah, correct. Absolutely. So there is two-way information there also, because usually what happens is the teacher asks questions. Facilitator asks questions they take turns, and then you go on asking question after question after question. If a student cannot answer that question, that will be put to the other student. Well, you can learn from that also, but this peer learning is not there. The interaction is between student and the tutor only. So the learning will be that much, and it will be not a very collaborative thing. It's a very, in a way, you are like in an exam. You are being asked a question and you need to answer it. So in a way, it's a more stressful environment. And not knowing the answer is not considered as a learning stimulus. It's considered as a disgrace. Okay, I didn't know. It's not entirely a free learning situation. It's more stressful situation where you are waiting until your turn is over. Until your turn is over, you are not even bothered about what the others are about what the others answer. You are not bothered because you are concerned about getting over this, your turn. So even although you can learn from what others answered, that will not happen. And anyway, you will not have time to learn because it happens so fast. Ask a question, give an answer. There's no place to explore that answer. No time to explore this answer, discuss that answer, and so on. So this can be viewed as a small group pretender actually. It's not actually a small group in the sense that we discussed earlier. Tutor fires questions at students who have come prepared to answer questions. So it's a Q&A session. No opportunity for discussion and clarification. Hence, it's more a teacher-centered. that's the tutorial. Tutorial does not need much preparation, of course, because you don't need a trigger, a scenario, nothing. You ask, okay, the students, okay, we have a tutorial on this day, come and on this section, and come and you can start asking questions. The learning there will be not that strong, but there will, of course, there will be some learning, nothing to deny that. But the learning will not be as strong as a small group or a PBL. Any questions? That's all. Any questions on this before there is a small section afterwards, just to sort of tell you about some of the other methods. So there are other methods also. Student-centered method. It's not only a small group and a PBL. I mean, this is not an exhaustive list. Quizzes, assignments, project work, you may be already doing these debates, practical classes for skills. So there can be various other ways of student-centered learning. You should know what to achieve and how to achieve. All these methods may not be suitable to achieve certain things. So if you need to learn new things, then probably PBL is better. If you want to apply and get some broader understanding about what is already known, plus improve your communication, leadership, teamwork, and professional attitude towards the other, then small group discussion would be better. If there are multiple ways of arguing things, then a debate would be good. So then you have to consider how many learners also. I mean, in a debate, you can have 10, 8 students. Others will have to listen. So then that is an issue also. Because the people who will be learning most would be the debaters. Unless you can afford to give opportunities for all students, then the debate may have consequences. But you can select from a menu of very active, engaging student-centered methods. Small group learning is probably PBS and small group learnings are probably the mainstay, but you can employ many others. Okay. Any questions before we move on to the next? Maybe we can take about 5-minute break and then come back, and then we'll move on to MCQs. I mean, no point in, again, it's the same. Doing is learning. No point in listening. Listening will give you an idea. You have to try it out and you have to develop your skills as a facilitator as well as a trigger writer. With the information that you would have got now, it will be soon forgotten if you don't apply. Same that we discussed with students. So best is write a trigger as soon as possible. I mean, in larger workshops, that's what we do. And then we apply this trigger in a small group so that then we can also get some skills in facilitation. That should happen very soon, in a few days' time. Otherwise, all this would be knowledge without application is very quickly forgotten, whether it's a student or any human being for that matter. That would be the case. And that's why we are doing small group. Okay, so we'll come back in maybe 5 minutes after 11. And we'll start MCQs.
Sure, Professor Gominda. Thanks a lot.
Yep. Hello, are we back?
Yes,
Can we start?
Professor
Okay.
Govinda.
Okay, I'm going to share screen. So in MCQs, we usually only discuss about single best answer questions. One of the reasons, I mean, there are many reasons for that. True false questions are usually in the world used only for formative exams. Although I know, use it for summative exams. Because true false questions may not elicit the actual ability of the candidate. One of the reasons is the guessing. Guessing, I mean, either the answer is either true or false. Even if you don't read, you can guess and get 50% of the time the answer right. Of course, to prevent that, we give negative marks. Then what happens is you can't really get to know what the student knows and what the student doesn't know. Because the student mark will be a combination of what he knows and what he had to forfeit because he got certain other things wrong. But in an exam, actually, the mark should be proportionate to what you know. That proportion is proportion is not the case in true false, because you have already, somebody has taken away what you know also due to negative marks. So for and due to those reasons and many others, the other is it's very difficult sometimes to, one of the others is very difficult to frame questions or statements which are absolutely true or absolutely false. As you know, in medicine, even if you say that heart is on the right side, well, there is a condition called dextrocardia. So, I mean, even if you, so it's not an absolutely true or false statement. So due to all these reasons, true false statements become a little bit tricky. So most international exam or almost all international exams would have single best answers as single best answers and single best type of questions. As so there are other types like extended matching questions, which is also a variety of single best, where there is one answer to a question, not for you to judge whether a particular statement is true or false, because without a lot of information, sometimes you can't really decide whether it's true or false in an abstract way. So we'll be also discussing mostly single best answer, or almost entirely. In a classical single best answer question, there are three components. So this is the basic anatomy of a SBA. First is the stem. Stem is a scenario. Now you can have questions without a stem, but we don't encourage that, because it is with the scenario that you can test application. Why are we interested in application? Because we want the students to apply what they learn to a clinical situation. That's what they will be doing when they graduate. So we are going to train them from day one on that and nothing else. So that's the stem. Stem is the scenario. Then the question is the leading. And then there are options, 5 or 4 options, one of which is the correct answer. As you can see, the stem is long because it should give enough information for the student to get one single answer. So a long stem is a good sign, but just to make it long, you should not add information which is unwanted, because that will only consume students' time to read that. Only the necessary information should be there, but the necessary information should be there adequately. And there shouldn't be unnecessary information. Lead-in should be very specific, not very long, single sentence, usually a question mark. Question mark is very good because a question format is very good because question format is good to specify a task. So the lead-in should tell you a task like what is the diagnosis, what is the nerve involved, what is the next investigation that you would require, what is the abnormality, whatever there is. Also, I should also say the STEM is usually written like what I said for small groups. STEM is usually a scenario, a text-based one, but it can be picture-based. It can be a photograph, X-ray, CT scan, MRI, whatever. Or it can be investigation result, full blood count or blood picture or whatever. Or it can be a video of a patient. If you want to show a tremor, for example, best way is a video. If you want to show a particular type of gait abnormality, best would be those, of course, cannot be most of videos, of course, necessarily cannot be paper based. It will have to be computer based, but that is possible. May not be in our setting, but international exams usually have it because now paper-based exams are not there internationally. Then the feature of options is options are short, arranged alphabetically, and of equal length approximately. There can't be very long options and very short options. Why? Because long options are usually the correct answer. Because why does it become long? Because we try to qualify it. And then smart student will know it. Okay, they are saying so much about this option, probably that's the right answer. So you should avoid that. It should be approximately. I mean, you can argue now option A is long. We are not talking about that type of length. We are talking about 2 lines at least. This is longer because the 3 words, one word is or 2 words there are quite lengthy. That's the reason. So the number of words should be 1 to 3 maximum. If you are having an option more than 3 words, then all options should be on the same length. But an option should confine itself to a line. 2 or 3 lines, not a good option. And they should be arranged alphabetically. Why? Because then the student, a good student will read the scenario, read the lead-in, he will know the answer. Then it's a matter of selecting the answer from the options. Then you don't need to even read all 5 options. If it is alphabetically ordered, suppose if you know that this is Guillain-Barré, then I can just go to G alphabetically. So then the student can save time. So that's the reason for arranging. If the options are numbers, you have to arrange it in ascending or descending, some logical way. So the most logical ways are ascending or descending order or alphabetical order, but there can be other ways. Now, for example, if it is on the nervous system, it can be from the central nervous system to the peripheral nervous system, the answers. That's possible. Then the third reason, the third feature of options is they are homogeneous. If you ask for a diagnosis, all should be diagnoses. You can't have investigations as options because any person will eliminate that option. This is not a diagnosis, so I'm going to eliminate this. If you ask for an artery, all 5 options should be arteries, preferably from the same area. If you ask for an artery in the upper limb and then you include femoral artery also as an option, then that becomes not an option because everybody will exclude that. So it should be homogeneous to the extent that a person who is not having very strong idea about this can be misled. However, there should be a clear correct answer. All the others should be wrong. Wrong or correct not to the same extent. Clearly, one should be the best answer. That's why you call it best. The others can be correct, but should not be the answer. So, for example, if you ask for an artery in the upper limb, all 5 are upper limb arteries, or all 4 are upper limb arteries, or within that region. But only 1 artery is the right answer. There can't be 2, 3 answers. Just 1 because student is asked to select only 1. So those are the basic things that I would like you to keep in mind. Long stem, very clear, precise, accurate lead-in, usually a question in the question format. Short options, homogeneous options, options of equal length. With 1 clear answer, the others may be correct, but not to the same extent. So that's in short, the format of an MCQ. Then, when you start writing, there can be obvious traps. One of the traps is you give a clue to the answer in the stem. That can happen. You give a clue to the answer in the stem. That's not impossible. Sometimes you give the answer itself in the stem, mistakenly. So any part of the answer, if it is given in the stem, that should not be the case. Then there can be options which can lead to the answer. For example, a particular option is also repeated in another way, in another option. Then again, that may give rise to clues. So options should be standalone. They should be different, but they should be at the same time homogeneous and same length, same type of length, with no clues whatsoever. And the options and basically the stem and the lead-in should be worded very properly. There should not be ambiguous terms. So we try to avoid terms like rare. What is rare? What is common? Because common to you and common to me, we may have different ideas. But far better to have a percentage thing. then certain words which can have different interpretation should be avoided. Now, all these are do's and don'ts. So all these are compiled within a table. I can share it with you. So when you are writing the STEM, what are the things that you need to consider and what are the things that you need to avoid, do's and don'ts. Same way when you write the reading, and similarly when you write the options. Again, I mean, options within options. Now, for example, simple, if you ask for a heart rate, if you give a ECG and ask for the heart rate, then all should be numbers. But if you say less than 100 and also the next answer is 80, both are the same. Less than 100 and 80 are both are the same. So a good student will know that, okay, there can't be two answers. Let me eliminate those, exclude those. So that will then kill your question. So that should not happen. Word repeats should not happen with the stem or the leading and the options, because that will give a clue. So there are some do's and don'ts. I can share those. I will share it on the chat. It's a one-page document. It's good to have that. Then we move on to what sort of ability that we should test. Another problem with true false is true false mostly test recall. So factual recall, that's the first thing. MCQs can, single best answers can also do that. But we should do this only sparingly. Application and judgment are the ones that we need to test in a single best answer question. If you want application judgment, you should always have a scenario. Otherwise, you can't apply. For factual recall, you don't need a scenario. You don't need a STEM. So these are the different levels at which you can test. So first two, even true false can do it. And true false, of course, there are other problems, so we avoid. Single best also can do it, but most of your questions should be application downwards. At least at the application level, it would be good. Right, here is a single best answer. What does it test?
Recall knowledge.
Yeah, you know it or you don't know it. Right, same question, I can set it this way. Same answer, right? Same answer and the same leading, same options, same leading. Or at least similar leading, but definitely same options. What is the difference then?
This is application of knowledge.
Sorry?
Application of knowledge.
Application of knowledge, yes. So what is the difference between this and this in the sense, the format? What is new? What is not? What is here but what is not there?
There is a scenario is there.
Yes.
Is the scenario? Yeah.
Yeah.
Yeah. And the leading point is there.
Sorry. Yeah, a lot of findings.
Leading, yeah.
But what is not here is the diagnosis. Here there is the diagnosis, Down syndrome. Instead of the Down syndrome, there are clinical features here in the scenario. So now the student will have to work out and know that this is Down syndrome, and then we'll have to know what causes Down syndrome. What is the chromosomal abnormality? So that is application, or probably a little higher than application. because it involves a little bit of analysis also. Now, this is a classical type of a evaluation type of a question. Again, there is a scenario, but all these options are right, but one of it is more right and clearly right, given the patient's age, the other habits of the patient, the progress of the disease, the symptoms, all that, given that. So this is a classical judgment because all are right, but one is more right. One is clearly more right. It's not that all are in the same group. No. Maybe 4 are close to each other, but one is clearly the more fitting answer. So that's your test your judgment. This, of course, is more sort of a postgraduate type of a question. We don't ask that much of those questions with undergraduates, but definitely application we have to ask because we are training doctors, people who are supposed to apply what they learn to clinical situations. Why construct MCQs at different levels? So here they gave 3 questions to 3 groups of students with similar abilities. Let's say 100 students, 100 students, 100 students. They gave 3 questions. But those 3 questions, like the Down syndrome one, had a very similar answer. Actually, the same answer. So here's the first question. Of course, it's at the recall level. There is no scenario. It's easy to identify as recall or comprehension level question because there is no scenario. Sometimes, of course, even with a scenario, it can be recall if you ask a very trivial question which you don't expect the student to apply their knowledge to the scenario. Then the scenario is just for nothing. You can really remove the scenario. So here, I think it's minimal change. The answer. This is the first type. Second type, again like the earlier one. So here it's a child with nephrosis and normal renal function. We don't say that. We give that in the way that they will see as a doctor, as a report. So it's a scenario now. If you see, these are the same. The options are the same. Options are the same. And the third one, then the third question is, they removed this generalized edema, ascites and all that. And instead they said what the doctor sees. What is that? Pitting edema on both legs. Shifting dullness in the abdomen. That's the third question. Options are the same. Leading is also the same. So these were 3 groups of students with similar abilities, getting 3 questions, 3 different formats of questions, basically the same question. And they marked the student answers. First question, 90% of the students got it right. Second question, only 82% of the students got it right. Third question, only 66% of the students got it right. So now it's clear why we need to ask application level questions. That's the level that they will want, they will use as doctors. Plus, you can find who really is at that level or not, ready to practice or not. They have knowledge which is practice ready, or they have knowledge just to pass exams. That can be worked out if you write good scenarios. Good scenarios means, I mean, level appropriate. You don't need to have a very complicated case scenario at the undergraduate level, even at the first year. They should be level appropriate, but there should be some application. Right, so let me share with you the guide that I told you. Let me share with you the guide. I will put that in the chat. See whether you get it. It's do's and don'ts PDF. Okay, now sent. You will get it in a few seconds. So if I share it on screen, it is something like this that you would have got. Right. So before writing, what to consider? What should you avoid? During writing, we discussed this briefly, what to consider and what should be avoided. Write in the leading, what should be done, what should not be done. Then checking whether everything is in order, and then writing the options, and then after writing what should be done. We discussed almost all of these. I mean, when before writing, you need to know what you are going to test. That's a must. You can't just start writing a scenario. You have to say, okay, I'm going to assess their knowledge on this. At which level, application or whatever. So learning outcomes and the content area should be in your head and preferably in a blueprint. So that's basically the blueprint. And at which level, factual recall or application or whatever. But basically it should be, most of the time, we should test at application level. What you should not do is turn a textbook and start assessing some very trivial fact in the textbook. That may be the recommended textbook, but you as a lecturer should know what is common, what are the things that they will encounter in the clinical situation, test them. If you start assessing trivial small print, they will learn that. If you test important things, then they will learn important things. So exams will drive learning. And you need to guide learning with good questions, important questions. Then only that the students will learn those important areas. When writing the STEM, select a common clinical case, include everything that is needed, but only the things that are needed to answer your question. Nothing extra, but adequately the things that are needed. So it's a long stem. And usually how you should do is take a scenario that you are already encountered in your clinical work or in your past work. That would be the best. Then you don't need to manufacture artificial cases. What you should not do is try not to synthesize for the candidate. Now, synthesizing for the candidate would be like giving Down syndrome, giving pitting edema, giving ascites in the scenario. That's not what they see as doctors. They see a sign or a symptom. Give them. Then it will be more work related. So avoid repeating words in the stem in the scenario, in the options. Tricky and complicated stems should be avoided. Clues to the answer should not be in the stem, all that we discussed. And usually don't include the stem question, because question can be in a different line. That will be clear the task. So the lead-in should be clear, unambiguous, clear task is given to the candidate after when he reads the stem. He reads the scenario lead-in, and lead-in will tell exactly the task. Now, why it should be question mark? That is the best way to ask a question. Now, avoid phrases like regarding. There are half statements regarding epilepsy. Then you are not clear what to do with it. It can be pathophysiology, it can be etiology, it can be treatment, it can be complications, it can be investigations, anything. So that sort of a lead-in will lead to heterogeneous options. We said the option should be homogeneous. So that's not a good, but you see it all the time. And that's bad practice and you should avoid it. Then avoid absolute terms like never, always. Those are incorrect ways of asking questions because they never happen that way. Rarely, you don't know what. Then also negative leadings. What is not correct? What is not the diagnosis? What is the most unlikely explanation? All those are rubbish questions. What's the purpose of knowing them? What's the purpose of knowing that a student knows what it should not be? We don't know whether the student knows what it should be. That's what we should test. Because no patient will come and tell a doctor, these are my symptoms, now tell me what I don't have. No, the patient will want to know what I have. So negative questions don't. Then once you write the lead-in, check the lead-in and the question stem match. They should speak to each other. They should be on the same lines. And the lead-in should enable the student to make use of the stem. Otherwise, stem is good for nothing. These are common problems if you don't know how to write an MCQ. So this, of course, can be even forgotten to an extent. Test within a test means there are certain things that the student need not know. But your lead-in and the stem will check them. A certain word, or let's say normal values, for example. If the normal values are not needed to be known, then you should include it in the stem. Otherwise, you are testing whether the student knows normal values on top of whether the student can apply. So that's a test within a test. Those should be avoided. Then options, we said one clear answer, homogeneous, short options, options of equal length, listed in a logical order, alphabetical, ascending, or whatever. Then automatically the option will be presented in different places. Not always A is the correct answer. It should not be. If it is arranged in a logical order, it will not be. Consistent, coherent terminology, like avoid things like pathognomics, typical, recognized. Those have different meanings. What should not be done are listed here. Avoid technical item flaws. Grammatical cues usually happens when the lead-in is not a complete question. Then there will be grammatical connections between the lead-in and the options, because lead-in and the options will now read as one sentence. That should not happen. Long correct answer, word repeats, all that should not be there. I will come to convergence. Convergence is difficult to avoid, but knowing that would be good. I will come to that later. Then things which make the exam irrelevantly difficult. Vague terms, overlapping options, trying to trick the candidate. Inconsistent numerical data, what I said. Heart rate less than 100, one answer. Second answer, heart rate 80. Double options, do X and do Y. Those things also should be avoided where possible. Language not parallel to others. Then also that will stand out. Either that will be excluded or that may be the right answer. All of the above and none of the above should be avoided. Why should you avoid, let's say, none of the above as an option? You may have seen many options saying none of the above. Why should you not have that as an option? Usually none of the above and all of the above is written when you run out of options. You should have 5 options, you have only 4. Can't think of another, right? Then you include none of the above. That's the usual reason for having it. That means you can't think of another good option. But the problem there is what? It's a nothing option actually. If none of the above is the right answer, you are not testing anything. You are not testing anything. You have not tested whether the student knows or not. Only thing that you have tested is student knows that on this option list, there is no answer. That's the only thing you have tested. So that should be avoided. Option list should have the answer. Otherwise, you are not testing anything. Because the question is to separate those who know from those who don't know. That cannot be done if none of the above is the answer. Because still, they will score marks for none of the above, if that is the answer. But you don't know whether they know the answer. You have tested only that the people who got it right know that there is no answer on this option list. That's the only thing that you have tested. So you should avoid it. All of the above, why should you not include all of the above? There the candidate only needs to know 2 options, recognize 2 options which are right. So there can't be 2 options that are right. Moment that is the case, then it's all of the above is the answer. So you are providing clues to the answer by including all of the above. And if all of the above is the answer. So what should be the options? Options should be the common mistakes that students make. Then you can catch them. Yeah. Because those are the common mistakes that students tend to make. Right. After writing, we need to answer 5 questions. One is, does the MCQ assess an important concept? Obviously, it should be the case, but better to check it. Does the MCQ test, factual recall, application evaluation, is that appropriate? Is that what you wanted? Can MCQ be answered by only reading the stem and lead-in? That is a must. Cover the options and see whether you can answer the question. That's called the cover test. That's a good way of identifying whether it's a standalone question. If by reading the stem and the lead-in, if you cannot answer the question, that's not a good question. Are all options homogeneous? Number 4. 5 is the MCQ. That means all 3 components, stem, lead-in, and options, divide of technical item flaws that we discussed. So this document is with you. You can keep aside on a side when you try to write questions. Of course, we don't have time to write questions. We will at least try to modify a question that you have brought. So these are some of the things that I want to show you. Again, this is what I earlier, I don't know whether, let me. Okay, so this is an important thing too. This is what I said. So how about, so if correctness of an option is in a continuum where one end is absolutely correct, the other end is absolutely wrong, there are A, B, C, D, E, 5 options. The first scenario is you have a MCQ, single best answer. All these options are at the incorrect end. There is one option which is at the correct end. Is this configuration appropriate? Is this okay? Yes or no? And why? Just tell what you think. It's quite okay to be incorrect.
Okay.
Sorry. Hello. No, I could not hear the answer.
In some questions, yes.
Yes, it may be a recall question, but this configuration is not a tricky situation. So this is okay. But look at the others. What about this?
Third one.
Third one is
Best.
maybe okay because although it's not like the first one, there is a clear distance between the next most plausible answer and the right answer. But this is definitely not appropriate. There are several correct answers or equally correct answers. There are here in the final one, there are 2 competing answers which are too close. You cannot expect a student to say A is less correct than E, although there may be a small point there. That's an unfair question. But the third one may be okay. It may be a difficult question. But there is a clear distance that the student need to identify between the correct and the next correct. Right, that's one thing that I need to show. Next thing I want to show you is the cover test and the reverse cover test, which we discussed. Right. So what we said earlier is cover the options and see whether you can answer. That's a good screening test for any MCQ, single best answer. And now, if you cannot answer, then the question is faulty. Because a good student will read only these two and figure out the answer and see whether that answer is available in the option list. That's what a student is supposed to do. Not to read the options and try to guess. So this is the best way to check whether the scenario, the stem and the lead-in are robust. Standalone, you can answer. Then we can do another one called reverse cover test. That is, you close the stem and see whether you can answer. Now, if you can answer without the scenario, then it's not a good sign. Then the scenario is useless. You have asked the student to spend unnecessary time in reading the scenario. Then you are not testing at application level either. Because you are not asking the student something which he or she needs to read the scenario, interpret, and then answer. You are not doing that. So that's not good. I will stop with one more thing. That is, let's take this. This is a very, very simple question. This is what I said about convergence. So this may be even very, very recall and simple. Now, suppose I don't know the answer. The way it has been written, the way the answers have been written, the options, I can reconstruct the answer. Why? Okay, here the correct answer is ORS, or oral rehydration solution. Suppose I don't know the answer. I take rehydration from option B. I take solution from option C, and I take oral from option D, and I reconstruct the answer, oral rehydration solution. Now that's what convergence is. The other incorrect options can be converged to a correct option. How to avoid this? Well, it's simple to avoid in a way, but check whether that's the case. Sometimes unknowingly, these flaws can creep in. What has the person who had made this question done? He had done only one thing. He had written the correct answer and tried to play with the words for the incorrect answers. Now that you should never do. He had tried to change the correct answer by playing with words. So he had left rehydration here and then said intravenous rehydration. He had left solution here, omitted these two and tried to write something. And then he had left oral and then kept oral and left the other two and tried to write something. Never do that as options, incorrect options. Don't write the correct option and try to change the correct option. That's the only way to. Of course, you can recheck also. But that you should avoid. Then we said don't give two things. This had been actual USMLE question on local anesthetics. Now there the problem is you are checking two things. The form and whether it's inside the nerve membrane or outside the nerve membrane. Now the problem there is you can work out the answer. A good test-wise student, a street smart student will work out the answer. So local anesthetics are most effective in which are the following conditions, right? So I will, it should be there should be a positive or a negative charge for it to work. No? So uncharged form is immaterial to me. I'm going to exclude that. Then out of cationic or anionic form, there is one anionic form and two cationic forms. So probably the correct answer is cationic form. Now I have come to B and C. Either B or C will be my correct answer. Then if you look at the 5 answers, outside the membrane is listed twice, inside the membrane is listed thrice. So probably inside the nerve membrane is the right answer. Then the B is the right answer. Cationic form acting inside the nerve membrane. So the lesson here is don't try to assess 2 things in one question. Try to assess one thing with one question. If you want to assess the other thing, write another question. That's A. B is don't try to populate the correct answer more in incorrect answers. So that's the B. B is the correct answer. So later, of course, this was a faulty question, so they removed this. So this is one of the USMLE questions long time ago, of course. Now you don't find these errors because they have been well trained to write these. Right, that's all. You can quickly show me one of your questions if we can still, I can still wait another 10, 15 minutes. You can quickly show me a question and all of us can then try to improve it if improvement is needed. If improvement is not needed, congratulations, then you have written a good question. Do you have questions with you? You can share the screen and see whether.
Yes, yes. I'm having the CAT exam of physiology and biochemistry.
Okay.
Which one you prefer to share, sir?
Yeah, you can share. I don't know. I'm not. I don't think I'm.
Okay.
So yeah. Okay, you can share. Yeah, you are the host anyway. I don't think you will find scenario-based questions, will you? Ah, right. Okay, there you are. Any comments on that?
No, actually, this question is even the 11th question is sometimes it's vague to me even. Now, it's a 60-year-old woman presented to a physician with swelling in both legs had been gradually worsening over the past several weeks. Now, pitting edema is there. Now, there were several differential diagnoses can be go through this. So with each and every differential diagnosis, the mechanism would have changed.
Hmm. I think what she wants to, or what whoever who wrote this wants to concentrate on hypoalbuminemia, correct? Is that what you wanted? Yeah, then other things would further complicate the matter. Is that what was the what were you trying to assess? Whoever who or group of people. Another good way of writing questions would be as a group. Or at least if you write a question, you can give it to a colleague who is within the, of course, within the staff and within the exam board, because I mean, these are confidential until you say, administer the paper. So you can't give it to all, but give it to somebody within the exam group or exam board to see whether it's working. That's a good peer review system. Or you can develop questions as a group. So can you tell us what is the purpose of what did you want try to my initial thought was you were trying to focus on hypoalbuminemia. I may be wrong. What were you trying to?
No, actually,
Yes.
I'm Dr. Bandusiri. Actually this question was set by me.
Right.
The student knowledge was tested about the stalling forces, how interstitial fluid is formed, and then the mechanism.
Yeah.
This is a different mechanism of how the edema is formed and the basic the applying the stalling forces.
Yeah, so that's obvious, but what was your correct answer, and what should the student think when you are?
Yeah, the answer is decreased plasma oncotic pressure.
That's what I thought also, because so you are just checking hypoalbuminemia type of thing, right?
Yes.
Yeah. I also got that impression. But will now the candidate not get it for reasons other than his not having the knowledge or her not having the knowledge? Will there be other reasons which will deviate her unnecessarily? That's the only thing. That's what the comment was, that, right? Earlier comment was that.
But as far as this generalized edema is concerned, all the responses are correct, homogeneous answer.
Yes.
But when you consider the hypoalbuminemia itself, it is specific. It causes reduction of the plasma oncotic pressure, leading to generalized edema. So if you consider responses B, C, D, and E, all can cause generalized edema. So I wanted to test the student knowledge by applying this clinical scenario, and the tested knowledge was the generalized edema causes, and basically tested the how the interstitial fluids are formed and the mechanism of edema. And so to make it a homogeneous, then I have included other B, C, D, E answers in a homogeneous way.
No, I agree with you for all that, and you have ordered it in alphabetical order also, and I see two increased. B and C are both increased, but if the candidate tries to think that way, he'll be getting it wrong. So that is also good. All that, I mean, I just worked out, so all that is good. Now, I mean, if at all, if there is anything to why did you include past several weeks? Because it's a gradual process to say.
Yes. Yeah. Because
So-
hypoalbuminemia does not causing
Not
the edema.
correct.
It take a
Correct.
time. It's not
Correct.
acute thing.
Correct. So that's one thing that you can, once you write, you can, that's relevant, but then you can argue, then you can not argue, then you can, well, argue with yourself. Okay, can I omit the first sentence? What if I omit? Because I need only hypoalbuminemia. It's true that it's being gradually, it's another piece of information to suspect hypoalbuminemia. But then hypoalbuminemia is given in the last sentence anyway.
Yeah.
Because then I'm giving only the necessary information. Now
Yeah,
the earlier.
no.
So
Yeah,
on
thanks.
examination, so there is pitting edema, patient with a pitting edema, generalized pitting edema with hypoalbuminemia. There, which are the following mechanisms is there? So I don't know. It's a matter of that sort of discussion is the one that you should have in a exam board. Whether you can improve it further by, actually this is not a bad question, so I'm not negatively critiquing it, but
yeah,
given the earlier comment also, so then the student will not deviate himself or herself. Okay, 60-year-old, both legs swelling, that of course is given anyway.
So actually, one point. After sir discussion, I can understand. Yeah. Thing. Yeah. So it's actually what he want to. The learning point is correctly mentioned, and yeah, the question was very nice. But only what is my concern is now, as it is, as you said, now the application of knowledge, whole of the application of knowledge, we can't exactly expect from a preclinical point of view. Now in a clinical scenario, you have to give some kind of diagnosis or something, because now as you showed the nephrotic syndrome, we can't exactly ask the clinical scenario and give an option, because nephrotic syndrome, the student doesn't know what is nephrotic syndrome. Until they go to pediatrics, they don't know what is nephrotic syndrome. So in the scenario, you have to give a clinical lead also in the scenario. So that is what in the preclinically we are facing.
Correct. So now this is not a bad preclinical question. There is still a scenario, but there is nothing that the student will not know. So my only, sorry. Yeah, go ahead.
Dr. Akib, this is actually during the body fluid lecture. So these theory facts we are supposed to teach to the students, so they know that this nephrotic syndrome and this these clinical type of scenarios.
Yes, sir. That is what I.
That.
Yeah, that's what I said. That after your discussion, I could understood. This is nice, actually. Yeah, what you are. That's what I told. Now, initially I didn't think, but after you are this thing, I thought this is correct way. Yeah, nice, actually. Great, sir. That's what.
Only thing. Now, yeah. So go
yes,
ahead.
go
okay,
ahead.
Okay. Yeah.
Now we are practicing, Prof. Gomin, what is this applied physiology during our lectures time, and then during lectures also, and we are trying to emphasizing some sort of a clinical applications.
Right.
So this is one of the areas. So we can't say that the student don't know about the. Even though they are first year in the preclinical, we can't say that they are not knowing these facts. Actually, this question was very well answered by almost all the students when I check the when I do markings.
Oh, right. That's good. That's very good.
No, that's what I'm also telling, sir. That's what this is how you're supposed to do.
Yeah, but I highly appreciate the Prof. Gomin's the very important facts about how to make these things, and for further assessments and exams, definitely we will use that knowledge. Actually, this also discussed in the scrutiny board, the faculty level as well as the faculty scrutiny team. led by final scrutiny was done by the team was led by our dean, senior professor Vidhan Patirana, and myself and the other two head of the department. So actually we also from as we are a bit of a clinicians working in the hospital as well as the faculty both, and we actually like to get the more knowledge, and we would like to apply the knowledge we gathered from the today's your lecture, sir.
Thank you. Thank you. So only thing, if you want to, I mean, I don't mind having the first sentence also, but if you want, you can also see whether deleting the first sentence will really make a huge difference. In that case, you are reducing the student reading another sentence. That will be good. So you have to slightly modify them. There should be some patient on bilateral quitting edema having hypoglycemia, and then rest of the things should be fine. So that sort of discussion can happen in exam boards, fine tuning and making it even more appropriate. But just one sentence, you can have it also, but it will not add much to the question. The first sentence.
Yeah,
but you can.
Thank you.
I am not very sort of very concerned about this first sentence. But if there are many such sentences, then you are making student read things which are not really needed to answer the question. The STEM should have only the information that is necessary to answer the question. If 60-year-old matters, if being a woman matters, yes, certainly you should include. But if those do not matter, then you are just including some information.
Yeah. Actually, it is not matter, actually, sir. The 60 years and the woman is not matter, Prof. Gomi.
Okay.
Thank you very
that's
much.
a nice question, though. I mean, if you can develop these questions, I think you are very much in the game. Because
Thank you very much.
the rest of the things I looked at, first thing I looked at is true increases. Is it the right answer? No. In that case, it's fine. Are the options homogeneous? Yes. Are the options short? Yes. Are the options arranged in alphabetical order? Yes. So, I mean, full marks for all that.
Thank you.
I think I have to leave a little now, but I think if you can go on like this in the same way, that would be really, really useful because that will be immediate application of what you heard. That would be.
So can I ask a question with regard to this?
I can stay 5 minutes, no problem.
Yeah.
For questions.
Rather than the laboratory test reveal hypoalbuminemia, is it worth giving a figure? It says suppose normal albumin level is 35 to 45. If I guess of the albumin level is 29. All right.
Yeah, that's even better. That's even better. Of course, you should think of the student's level also. If the student is at a advanced level, certainly you should not say just hypoalbuminemia. You should give a laboratory report.
Yeah.
Maybe
do we have to give the normal value always?
Again, that's what they see in the that's what they see in
USMLE and the yes.
No, I mean in the clinical setting. In the
Yes.
clinical setting, any laboratory investigation will have a normal value.
Yes,
Always
correct.
try to match what you see in the clinical setting with the question. Then that problem will not be there.
Okay, thank you. Thank you very much, Prof.
Okay, sorry, I had to be a little late because in the morning I had to go to my main university to discuss a matter. Then I had to come to my faculty to start this. That was the morning delay. But I think I hope you got something to think about and apply, both in terms of small group learning as well as in terms of question writing, MCQ writing. Over to you, whoever.
Thank you so much.
Okay, okay.
Thank you so much, Professor Gominda, for this insightful session. Actually, we gathered a lot new and that will be definitely useful for us. Thank you generously for dedicating your long, valuable time with us with the high commitments in your field. Actually, really thank you, sir. And I would also like to express the sincere appreciation to our Dean for creating such kind of innovative and useful workshop. Finally, not but not the least, I would like to express my sincere thanks to all these lecturers, heads of the departments, and extended faculty members from Teaching Hospital Badulla to take part in this workshop regarding continuous professional development. Once again, thank you all for your valuable time spending in this useful workshop. Thank you, sir. Thank you all.
Thank you.